The social care sector is increasingly reliant on volunteers in the voluntary sector to provide adequate care to older people. We visited 7 organisations in the South West. They were chosen for the different ways they provide social care for older people. These were a retirement village, 2 day centres, an activities programme, a care home, a hospital discharge service and a lunch club. In each setting, we conducted qualitative, in-depth interviews with staff, volunteers, service coordinators and service users. So what did we learn? Our findings fall into 4 broad categories. Firstly, volunteer involvement with social care organisations varies from augmenting existing services, such as befriending services in residential care, to filling gaps in provision. For example, taking part in activity sessions in daycare settings and providing discrete services. Where volunteers augmented or provided a discrete service, their roles had clear boundaries, separating their duties from paid roles. In contrast, where volunteers fill in gaps in provision, it's much less clear what distinguishes their role from that of paid workers. This lack of clarity is reflected in the interviews with service users, who were unaware whether providers were paid workers or volunteers. Secondly, our initial findings indicate that volunteers are making a substantial contribution to care and support services of older people. Social care organisations value this contribution, notably as a way of alleviating loneliness and isolation amongst service users. Older people describe positive relationships with volunteers in roles that were fundamentally different and discrete from paid staff, concentrating on practical and medical roles. For example, in befriending services, volunteers would maybe play chess or talk about books the older person had read. Thirdly, the role of coordinators and managers is really valued by volunteers, who appreciate a transparent route into the position, a clearly defined role and a person to speak to about any concerns. In situations without a dedicated coordinator, volunteers were more likely to feel less clear about their roles and were less likely to stay in that role. Finally, our findings contest the idea that there is an army of volunteers that can be drawn on to aid the delivery of social care. This is due to a number of factors: increased intergenerational care, rising female employment, later retirement and rurality. This impacts upon the delivery of services, particularly where those services already rely heavily on volunteers. At sites where there were fewer difficulties with recruitment and retention, volunteers spoke of how the positive reputation of the organisation had drawn them to the role. As for the reasons for staying in a role, long-standing volunteers most often described the close connections they made with older people and the importance of small tokens of appreciation. These ranged from a simple hello from a paid member of staff to thank you cards and inclusion in social events. The demand for care services for older people is rising in the UK. This is coupled with underinvestment in primary care, leading to less emphasis on preventative services, potentially resulting in more need for social care. Recruitment and retaining paid staff is becoming increasingly challenging because rates of pay are typically low and the work is undervalued. As volunteering becomes more prevalent in social care, we need to monitor the appropriateness of having unpaid workers carrying out roles that were previously undertaken by paid care workers. For more information about the ERVIC study findings, please see our other videos, where you can hear the testimony of both service providers and users. Or visit the ERVIC page on the University of Bristol's School for Policy Studies website.